It is the 27th of June, this 2016. I am Ralph Turchiano. I'm here to cover with you the top 3 health headlines of the past 7 days. Starting off with number 1. The World Health Organization may have caused thousands of unnecessary tuberculosis deaths. The authors of the study, or I should say authors of the report, said as follows. The World Health Organization violated its own constitution and international law from 1993 to 2002 by recommending and supporting a double standard of care for multi-drug resistant tuberculosis. The authors described the role the World Health Organization played in Peru as the country worked to defeat tuberculosis in the late 1990s. World Health recommendations steer Peruvian health practitioners away from implementing a known effective yet more costly treatment, resulting in thousands of avoidable deaths. They nudged poorer countries to follow less expensive, untested, and largely ineffective treatment protocols for tuberculosis patients. Without effective treatment, most people who are sick with any form of tuberculosis will infect other people in their families and communities and will eventually die from the disease. What this is a giant failure of the World Health Organization and its responsibility that it's been granted in order to protect people from, or at least stem the spread of communicable diseases. In this case, they actually may have participated in it. Number 2, study links omega-3s to reduced mortality. And this is a pretty significant reduction in mortality from taking omega-3s. A recent meta-analysis in scientific report supports a link between EPA and DHA omega-3 intake and reduced risk of death by any cause. The meta-analysis included 11 studies involving 371,965 participants and 31,185 death events, with a subset of the studies being used for different analysis. There was a 9% risk of all cause of death associated with high versus low omega-3 intake. The meta-analysis of 11 prospective studies, as you go further into the research, which you hear this. The meta-analysis of the 11 prospective observational studies demonstrates that for each 1% increment of omega-3s in total fatty acids in the blood may be associated with a 20% decrease in risk of all causes of mortality. To me, that is pretty major news, but they must have just skipped over that by accident. Number 3. Beneficial bacteria may protect breasts from cancer. They wanted to see if probiotics and things along those lines actually may have any positive and or negative impact on breast cancer. The answer to that question is yes. The motivation of the research was the knowledge that breast cancer decreases with breastfeeding. Since human milk contains beneficial bacteria, we wondered if they might be playing a role in lowering the risk of cancer, or could other bacterial types influence cancer formation in the mammary gland in women who have never lactated. So they wanted to explore this question. And this is what they discovered. Women with breast cancer had elevated levels of Escherichia coli and Staphylococcus, which are known to induce double-stranded breaks in DNA. Bottom line, it's bad and may cause the spread of cancer, which were cultured in human cells. While conversely, Lactobacillus and Streptococcus, considered to be health-promoting bacteria, which were more prevalent in healthy breasts than in cancer ones. And this is the positive in regard to it. Colleagues in Spain have shown that the probiotic lactobacilli ingested by women, whether through food, diet, powder, capsule, whatever, can reach the mammary gland. Combined with our work, that raises the question, should women, especially those at risk for breast cancer, take probiotic lactobacilli to increase the proportion of beneficial bacteria in the breast? Of course, that is for future research. And those are the top 3 health headlines of the past 7 days. I hope you find this information useful, and I will catch you all once again next week. Ralph Turchiano signing off. See you then.